Do you have an appointment with us today? Okay. Cool, let me get you checked in. Can I have your name, please? Okay. Okay, and last name? Okay, and then can you, actually, when was your appointment for? Oh, I see right here. Okay, and then, can you confirm your date of birth? Okay. Perfect, and, what's the reason for your visit today? Right, okay, so I see we have a cranial nerve exam on file, ready to go. Is there any specific reason why you requested this? Any issues that you've been having going on? Is it like an employment requirement? Sorry, excuse me. Okay, and then are you currently taking any medications? Okay. Any actually, when was your last visit with us? Okay, it's a couple of months ago. Have you discontinued any medication since then? Okay. Okay, I see. Alright. And any other major health concerns that have happened between your last visit and now? Okay. Good. Alright, perfect. So we can go ahead and get started with your exam today. I'm gonna first put on some gloves and we're gonna take your temperature. Okay, go ahead and open your mouth, and I'm gonna put this under your tongue and go ahead and close. I'm just gonna wait for a few seconds here. Okay. Alright, temperature is 97.8. It's a little bit out of normal, but it's within normal limits. Okay. Perfect. So we are going to get started with your cranial nerve exam. We're just going to be testing the cranial senses. So that's going to be your vision, your sense of smell, your sense of taste, sense of touch, and your hearing, okay? So we're going to start off with your vision, with your eyes. I'm going to first do a visual inspection of the physical part of your eyes here. So I'm just going to get a little bit close here. And I'm just going to be very gently examining your eyes. Okay, can you close your eyes for me? Perfect. I'm just going to gently inspect the eyelids here. Okay, perfect. You can open. Go ahead and look up just with your eyes. Good. I'm just going to inspect the conjunctiva. So the pink in your eye. And it looks pink, not too white, which might indicate an iron deficiency. Looks normal. Okay, can you look that way? Perfect. And look that way. Good. Look up. Good. And look down. I'm going to hold your eyelids a little bit open. Perfect. Okay, you can relax. Very nice job here. Okay. Alright, and did you have any pain with that? Okay, good. And then have you been experiencing any problems with your eyesight? So blurry vision, light sensitivity, headaches, anything like that? Okay. Alright. Perfect. Oops. Okay. Alright, so I'm gonna start using my flashlight now. We are going to, sorry about the strobe. Okay, I'm going to first look at the pupil's reaction to light. So, good, okay. And this eye as well. Perfect. Good, and we're looking at the reaction of both pupils when we shine light into one side here. Okay. Good, I'm just gonna go from the top and bottom as well. Okay, good. Everything looks normal. I'm gonna ask you to follow my pen here, just the top silver part of it right here, okay? And don't move your head, just move your eyes, okay? Good, okay, just going in and out, looking for the convergence of the eyes or of the pupils here. Good, okay, perfect. I did just want to take a look at your corneas here for any scratches. Looks clear to me. Okay, and right eye looks clear as well. Okay, sorry about my chair. Okay. Alright, the last thing we're gonna do with your eyes is some peripheral tests, okay? So these are pretty fun. First thing that I want you to do is focus on my nose, and I'm going to bring my fingers outward, and I want you to let me know when you can no longer see them, okay? They're not in your field of vision anymore, okay? Are you ready? Go ahead and look here. Good. Perfect. Good. Perfect. Okay. Same thing. I'm just going to be shaking my fingers, okay? Go ahead and look here. Good. Perfect. Good. Perfect. And one more time. Good. Okay. Great. The next thing that we're going to do is I'm going to have you look at my nose again, and I'm going to wiggle one side of my fingers and just tell me which side you see wiggle, okay? Good. Perfect. Good. 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 Perfect. Good. And awesome. Okay, great job. Alright, the last peripheral test we're gonna do is, again, you're gonna look at my nose, and I'm going to hold up numbers, and I want you to just tell me what number you see, okay? Alright, go ahead and look here. Good. Perfect. Good. Sorry, one. Good. 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 Perfect. Good. Good. Okay. Awesome job. Okay, so we are all done with your vision tests. You did very well. We are going to move on to hearing, okay? Okay, so we are going to start your hearing test. The first thing that we're going to do is I'm going to whisper a series of numbers into each ear, and you're just going to repeat back to me whatever you hear, okay? Okay, and then after numbers, we're going to do words in each ear, okay? Okay, but before we do that, I'm actually going to visually inspect your ears here, okay? So I'm going to have you turn to this side. Good, okay. And I'm just inspecting the outer ear, the pinna here. Okay, cartilage. Seems intact. And looking to the inside of the ear. Inspecting the tympanic membrane. Ear canal looks good, okay. Alright, and go ahead and look that way. Good, okay. Again, just inspecting the pinna of the outer ear. Some cartilage intact as well. And the ear canal looks intact here. Okay. Perfect. Alright, so now we're going to start the hearing test. I'm going to start with numbers, okay? Alright. 765. 765. 765. 765, perfect. Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 3, 3. 1, 2, 3. 1, 2, 3, perfect. Okay. Just 2 more, okay? 4, 8, 9. 4, 8, 9. 4, 8, 9, perfect. 1, 8, 5. 1, 8, 5. 1, 8, 5. 1, 8, 5, perfect. Okay. Alright, so now we are going to do words. I'm going to start in this ear again. Basket, 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 basket. Basket, perfect. Okay, and we're going to do this ear. Kit Kat, Kit Kat, Kit Kat, Kit Kat. Perfect, Kit Kat, okay. Liquid, 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 liquid. Nice, liquid, okay, and last one. Fox, 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 fox. Fox, perfect, okay. Alright, let's see. Physical inspection looks good. And numerical tests also good. And then spoken words also good. Okay. Any issues with that? No? Okay, no pain in your ears, no ringing or muffled hearing or anything like that? Okay, good. Okay. So next we are going to move on to your nose. Okay, we're going to do your sense of smell, but first I do want to just check your nose and look into your nostrils. So I'm going to have you tilt your head up for me a little bit more. Okay, perfect. And I'm just going to take a look in here. Okay, septum does not appear deviated. There's a normal amount of fluid and secretion. Okay. Good. Can I have you plug one nostril and breathe in through your nose? Good. And other side. Perfect. Okay. Alright, any pain with that? Awesome. Okay. Alright, so for our smell test, we are going to have you just take a smell of some different scented gum sticks, okay? So let's start with the first one. Okay, what does that smell like? Watermelon, perfect. Okay, we have 2 more. Okay, coffee. Awesome job. Okay, and last one. Vanilla. Okay, great job. Okay, and have you had any difficulty smelling recently? Okay, what about any feeling like you have a blocked airway in your nose? Clogged nose, runny nose, anything like that? Okay, no issues with your sinuses? Okay, you did pass the smell test, so that's great. Didn't notice any problems there either. Okay. Oops. Okay, so the next thing that we're gonna do is we are going to test your sense of touch, particularly in the face area because that is your cranium. And then we are also going to test on the palms of your hands as well, just because there are motor neurons obviously going from there to there. So the way we're going to do this is with a brush, but actually before we get to that, I did want to do a visual inspection of your skin, okay, using this light. So I'm just going to examine the condition of your skin, assessing for any excessive flakiness or dryness, any lesions, bumps, scratches, bruises that might need attending to. Okay, and everything looks good so far. Skin appears normal color. I'm going to do a warmth assessment. Okay. Even in warmth throughout. Okay, looks good to me. So we're going to move on to the brush. This is going to be the soft side. This is dull. I'm gonna have you close your eyes and tell me which side of the brush you feel, okay? Sharp or dull? Sharp or dull? I don't know if I just explained it the right way, but dull or bright. Okay, so go ahead and close your eyes. Okay, good. Perfect. Good. Perfect. Good. Good. Perfect. Okay. Nice job. Okay, you can open your eyes. Now what we're gonna do is I'm only gonna touch you with the sharp side of the brush, and you're gonna tell me where on your face you feel it, okay? Perfect. Okay, go ahead and close your eyes. Forehead, good. Right cheek, good. Left cheek, perfect. Chin, good. And nose, perfect. Okay, great job. You can open your eyes. I'm going to ask you to lay your hands out, palms face up, fingers wide on the table, just like that. And we're going to do the same thing as the first test. So I'm going to either brush you or tap you and just let me know sharp or dull, okay? Alright, so I'm going to do on your hands. You're going to close your eyes. Good. Perfect. Good. Good. Perfect. Good. Good. Perfect. Awesome. Okay. Great job. You can open your eyes. That's it for our sensations test. You did very well. And have you been experiencing any numbness or tingling on your skin throughout your body? Any abnormal feelings of extreme coolness or warmth? Okay. Good. Perfect. Okay, great. So the last sense that we need to test is your taste, of course. So first we are going to again visually inspect your mouth. So go ahead and open wide. Good. I'm just taking a look at the tongue, uvula. Go ahead and say ah. Good. Okay. Alright, and can I have you stick out your tongue? Good. I'm just looking at your back teeth here. Okay. Alright, and can you move your tongue up? Good. Looking at the bottom teeth. Okay. Looks good. Okay, can I have you stick out your tongue and move it side to side? Perfect. Up and down. Great. Okay. So, we are going to be doing your taste test now. I just have some different flavored sticks here, and you're just gonna try one and let me know what you taste. And just like the smell test, these flavors are pretty recognizable, so we are going to start with this one. Here you go. Go ahead and stick out your tongue. Okay, and what does that taste like? Chocolate, perfect. Okay, let's do another one. And what is that one? Mint. Awesome. Okay. And last one here. Raspberry. Perfect, perfect, perfect. Okay. Alright, so you did very well on the taste test as well. Okay. And did you have any issues with that? Okay, any problems chewing with your jaw, tingling in the tongue, toothache, anything like that? No? Okay. Awesome. Okay. Well, with that, we are actually done with the exam. You did very well. All of your cranial nerves seem to be intact and functioning at normal levels. Did you have any other concerns or questions, comments for me today? Okay, well, you did awesome.